This is Rhonda Mower, and I am Vice President of Diversity, Equity, and Inclusion and Belonging for Volunteers of America. And today we are joined by some amazing guests, and one amazing guest in particular. And I will actually turn it over to them to introduce themselves.
Okay, thanks, Rhonda. I'm Rita Nakashima-Brock, and I'm Senior Vice President of Volunteers of America and direct the Shay Moral Injury Center here. I've been concerned about news about the hate crimes against Asian Americans because many in the VOA community and also our friends and neighbors are Asian Americans. And so the first person I thought of was a colleague I've had for many decades. I've liked and admired a great deal, who's an Asian American sociologist who has been doing extensive work in this situation now with the rise of hate crimes. And so I'm going to turn it over to Dr. Russell Jeung to introduce himself and tell us about his research.
Thanks, Rhonda. Thanks, Rita. And thanks to VOA for inviting me. I'm Chair and Professor of Asian American Studies at San Francisco State. And early on in January, I began to notice, once the COVID-19 pandemic began to really hit the news, that Asian Americans in the United States, and actually Asians globally, were beginning to experience a lot of harassment. Media, there were a lot of viral memes and taunts about them. And I knew from history that in the past, Asians have been scapegoated for diseases, and because of the scapegoating and blaming, they've been excluded legally, they've been quarantined, they've been deported. If they came through Angel Island, they were sent back. And so we knew, especially since SARS, that anti-Asian sentiment would increase with this outbreak. I began to document it, and because we didn't have any clear numbers, I began to document news stories and count how many news stories include phobia and COVID-19. And globally, I tracked it, and then in the United States, and we found a 50% increase in just 2 weeks of this being reported. And given that sort of documentation, we were able to establish a Stop PI Hate Center to get firsthand accounts. And I did the community organizations, Chinese for Affirmative Action, and Asian Pacific and Policy Council, because people were more likely to report to a community organization they knew than to the police or to the government. And within 2 weeks of starting this reporting center, it's all online, and we got over 1,200 cases of anti-Asian harassment, discrimination, and assault. And if you read the self-reported stories, they're really harrowing and just disturbing of how much hate there is and how much fear, I think, is compelling people to act this way. The incidents range from being shunned, like on public transit, to being verbally harassed. But again, it's not just name calling, but it's with a vehemence that's palpable. It's yelling at people in their face with their kids and elderly parents present. And then it moves to workplace discrimination, which is actually pretty bad too, because people get singled out and told to go home if they're Asian and they're coughing. And then it goes all the way to assault. So 10% of our cases are actually physical assaults, where people, it's clearly racially motivated because they yell, the coronavirus occurs because of you. And one particular case in Midland, Texas just occurred a few weeks ago, where a refugee family from Burma, they're not even Chinese, they were shopping at Sam's Club, and 3 of them, including 2 kids, were stabbed. And the assailant actually admitted that he was thought they were Chinese, and he said, the coronavirus happens because of you. So that's now being investigated by the FBI as a hate crime. So we've been collecting all this data. The FBI says they're expecting an increase in a surge in hate crimes, but we've already seen the surge in hate crimes. And the other thing that our data shows, there's 3 main trends that I've noticed. First, that women are harassed 3 times more than men. So it's a very gendered experience, and we're arguing women are always harassed by men, and men are just using the coronavirus now to harass API, Asian Pacific Islander women. it's a clear instance of racial profiling that 60% of our respondents are not Chinese. So they're just people who look Chinese, and people mistake them for being Chinese and attack them. And it harkens back to the Vincent Chin case, where he was mistaken for being Japanese, and he was killed in the 1980s because of anti-Japanese sentiment. So there's a gendered component, there's racial profiling, and the third disturbing trend is that there's people are getting coughed at and spat upon a lot. And it's sort of a particular form of harassment related to the disease, but it's also a public health threat. It's actually a physical assault if you get spit on you. Mm-hmm. And a white guy on the East Coast got arrested for terrorism when he coughed on a white cashier and on the groceries, at a grocery store, on the produce. But so he gets arrested for a terroristic attack. Asians are getting attacked daily by being coughed and spat upon. My wife got coughed at. And so you could even argue that this is a case of terrorism against Asians in the United States. It's that severe. It's not isolated cases. It's not us just being super sensitive to racial issues. It's a widespread phenomenon that I think is actually fits a historic pattern that's been exacerbated by political rhetoric. And now, because of social media, it gets actually becomes viral really quickly. So there's similarities to this anti-Asian sentiment, but also a lot of new aspects to it.
Yeah, I would also, I've been noticing, I think I heard about it about a month ago. The first news story I saw about it sort of go across my consciousness. And so I started to pay attention. And then I began to notice that even in American media, when they're talking about COVID-19 in the United States, they would show images of Chinese people wearing face masks. And they would show images of China all the time, not US COVID-19. And that keeps happening. You can see it, and it's almost like one of those subliminal 5-second messages that just shoots across the screen that's unconscious, where they're saying, oh, in New York City, we're seeing blah, blah, blah. And then they'll show a person wearing a face mask, and it'll be an Asian person.
Yeah, that's actually what our research shows, that when people racially profile, they sort of operate on their implicit bias that makes automatic assumptions. Mm-hmm. And when politicians keep on referring it to China virus or the Chinese, when, as Rita mentioned, when the media keeps on showing stories about COVID-19, but then showing people with Chinese people with masks on, then subconsciously what gets imprinted on our minds is that, oh, this virus is connected to Chinese people, and especially connected to Chinese people with masks. So just after 9/11, people who looked Muslim were racialized, and if you wore a turban, that became an object of scorn or threat. Today, an Asian in a face mask is racialized as a threat. And so when people are threatened and they have this automatic assumption, there's either flight or fight mode, right? And so they flee Asians by shunning them, or they fight them by attacking. And so it is how people, we're not calling people racist when they act this way. Like Rita said, these images are subliminal. So even I am sort of, as an Asian, I am probably more hesitant if an Asian coughs than if a non-Asian coughs. If I see an Asian with a mask, I may think they're more of a disease carrier than if I see a Latino person wearing a mask. And so it's an automatic assumption that you make, and you just got to check your biases. But a lot of people aren't doing that, and instead they're shunning Asians or they're attacking Asians,
Yeah, and I actually thought it might be safer for me to be wearing a face mask, especially when I go shopping for groceries. But then I started worrying about how I would get treated, and I really hesitated to wear one, because I just thought, oh my gosh, that what if somebody hits, one woman had her jaw broken, another woman just punched her in the face for wearing a face mask. So I finally, a neighbor made me one with little baby turtles on it, and a friendly looking face mask, and it was kind of big. And so I was able to put it over my face and wear a baseball cap. And I thought maybe you couldn't see my ethnicity as easily if I was in that sort of somewhat disguised state. But I think about it every time I go outside with a face mask on.
Yeah, so I think Asian Americans are hyper aware and sensitive to how other people are perceiving them now. It's just like how other people of color are conscious of um, being seen as threats or being seen as dangerous or being seen as other. And so for Asian Americans, they suppress coughs because if you cough, then you may be singled out. You try, and this actually impacts the youth a lot now, right? So there's a lot of bullying before schools were shut down on the schools. On social media, again, a lot of youth are very aware of how Asians are perceived. So one of the mental health impacts of this is that I think a lot of Asian Americans, seeing how people shun them for looking Asian or being Asian, that they'll sort of want to avoid their Asianness too, that they'll want to, they'll sort of internalize the stigmatization and sort of shy away from identifying as Asian. And that's been, I think, something to deal with actually for years to come, is how to help people sort of develop resilience against being bullied and harassed, and how to help people develop a healthy ethnic self-esteem again.
Yeah.
But that's, yeah.
Yeah, and I think some of the advice, you know, everybody's trying to give people advice about how to deal with this, and one of the more controversial forms of advice has been, well, you know, just try harder to do nice things and volunteer and go, you know, like to prove you're really American, to prove that you're really patriotic, as if anybody should have to prove in a pandemic those things by taking risks with their own lives to demonstrate to people that they belong here. But
it's also, I'm sorry to interrupt, it also strikes me that it's blaming the victim.
Right.
You know, and how unfair is that? And I also have to say that, you know, I'm really emotional, you know, after hearing you both share your stories and the stories of other Asian Americans and Asian, you know, people of Asian descent around the globe. And it's just heartbreaking, you know, frankly. And when I just wanted to share that when Rita first, you know, I read an article by the Center for Disease Control, and they actually had on their website that a whole article on reducing stigma, and they identified that Asian, you know, persons of Asian descent, as well as healthcare workers and first responders, and I think we can also include those who are on the front in any way, as people who are at risk of being stigmatized because of COVID-19. I mean, the Center for Disease Control said that, and so I did a brief article on that, making people aware within our organization that this is something that may occur. And they also provided some suggestions, they being the Center for Disease Control, provided some suggestions on how we can make a more welcoming environment for persons of Asian descent. And that's how Rita and I started conversing about this. And so I'd like to, before we move on, you know, and talk about, you know, what we can do to make people feel more safe and more welcome, I'd like to touch on briefly, Russell, the historical context of this, because I think it's important for people to know this is not out of the blue. This has happened before.
Right. Yeah. So we expected this as Asian Americans. The United States and the West has a stereotype of the Yellow Peril, and it originated probably a lot, maybe even before, but it was used a lot in the 19th century. And the Yellow Peril would be the fear that Asia, hordes of Asians would rise up and dominate and take over the West. And one of the ways the Yellow Peril would operate is that these faceless, nameless Asians would come and bring disease. And that's one of the ways they would take over. And so during the smallpox epidemic in the 19th century, when malaria and leprosy, those three diseases were used to exclude Chinese in the Chinese Exclusion Act. So that was the basis of the Exclusion Act. In 1900, the bubonic plague came to the United States, and Chinese were the first to have it. So they actually burned down Honolulu, Chinatown. They made 7,000 people homeless, turning down Honolulu, Chinatown. They spread the rats. In San Francisco, when the plague came, they quarantined Chinatown with barbed wire, and they kept thousands of Chinese in there to get sick, but they let whites in and out. And so this Yellow Peril continued. Japanese American incarceration is again that fear that Japanese are disloyal, they're foreigners, and so we can incarcerate them and detain them. And when SARS hit in 2003, again there was a lot of anti-Asian sentiment. So I think in the back of the racial subconscious of the West is this fear of that Yellow Peril, and we just seeing that Yellow Peril threat being resurrected. And so again, Asians being a disease carrying, being an outside threat, Asians coming to take over part of the type that Asian Americans have to deal with. The other side of that stereotype is, oh no, we're the good Asians, we're the model minority, like people say, if we just prove ourselves, then we won't get attacked, right? But they're both part of that same dynamic that Asians are different from the West. They have to prove themselves to be worthy to be part of the West, but they'll never really belong.
Wow. Well, thank you. Thank you for sharing the historical context more deeply with us. And, with that in mind, the Center for Disease Control, that brings to mind some of the suggestions that the Center for Disease Control recommended. And you both touched on one major one here today, and that is, media coverage, the images that people are seeing, making sure that we're not reinforcing negative stereotypes when we're utilizing images in our organizations and out there in the media. Can you share some more suggestions from your point of view? And Rita, feel free to step in as well. But Russell, can you share with us some suggestions that you have on what we can do? And actually, before I'm gonna interrupt myself. I'm sorry. I'd like to hear some about what you've done, because I seem to recall that you've taken some definite steps to help Asian Americans and others feel safer during this pandemic.
Right, thanks. Yeah. Well, with our documentation, we realize policymakers don't believe Asian Americans face racism or face any issues. But with our data, we were able to present it to, in California, to our legislators, and they really took it to heart. We have Asian Pacific Islander legislative caucus, and they took the recommendations and they presented them to the governor, and he immediately denounced anti-Asian behavior. So again, like we argued, it starts from the top. Political rhetoric can be really inflammatory and incite racism, and so you got to have officials denounce it. And actually, that's part of the pattern we've seen in the news trends, that you would start with a xenophobic statement, and then immediately after you would see economic boycotts of Asian businesses and then interpersonal attacks on Asians. But the other news trend is that Asian Americans, communities, and officials denounced that racist behavior. So part of our history is that we've always been vilified when diseases hit, but we've also, as Asian Americans, have always resisted this racism. And so I think that's part of the history that we also have to say. And even today now, Asian American communities are resisting that racism that they're facing. So the Legislative Caucus are in Congress too. They're putting up resolutions denouncing anti-Asian rhetoric. And so it's coming from the top. And in all those, they're using our data to say, we know this is happening. It's a sociological reality that Asians are facing harassment and assaults, and so we need to address it. And so that's how our data has been used on the political level. And then we have specific policy recommendations too. On the community level, knowing that kids are being bullied, know that parents that don't know how to help their kids, knowing that people are facing workplace discrimination, we're developing resource pages, and we're having local agencies share this type of information, having legal agencies provide referrals. So I think that's, again, the best way to get out information to community members who are affected, to have trusted community organizations provide these resources. So the data is being used both to give people a voice individually, and then as a collective voice, we're using it to push for better policies and to be responsive to community needs.
Wonderful. That's fantastic.
I think internal to VOA, because I think we also have things we can do. Mm-hmm. We do have medical facilities, and sometimes people have been refusing care from Asian American medical caregivers, or even trying to, like, won't let them touch them and things like that. And I don't think in that situation it's a way to try to discipline somebody's racist responses. I mean, so we can support the Asian Americans that work on the direct lines with clients to make sure that they don't get assaulted, and make sure that there's some backup for them in case that the patient doesn't want to see them, rather than trying to force a situation, and just sort of providing some support and comfort to people who experience those things that happen. And I personally have sort of decided that wherever I can order a delivery or go find something I need from an Asian business, to frequent an Asian business. So the only restaurant I've been doing food from while I'm confined at home is the Thai restaurant 2 blocks away that I don't want to have it to close down, and it's still doing delivery food and pickup. So we because so many people have been avoiding Asian businesses, I think another way to make a positive good is when you can buy from an Asian business that you have been using before and you should make an effort to keep them in business.
Excellent suggestions. Excellent. And I also recall that there is some sort of signature, some sort of document that's going around that, and Rita, you shared that with me. Would you speak to that for a bit?
Yeah, it's an Asian American Christian Collaborative that's issued a really wonderful statement that gives a little bit of historical context, also some proactive things that people can do, that is grounded in understanding the problem, and people can sign on to commit to the faith statement involved in it, and also to the actions and things that they recommend. And that website also has links to other resources, because there are lots of them appearing. There's really good stuff that's now being generated online as a positive solution to the problem.
Wonderful. Well, I have signed that statement, and for those of you that are looking at this, we will share a link to that statement so that you can sign as well. And I will be sharing it with my LinkedIn network and pretty much everyone that I know, because it basically states, we're not having this. This discrimination is not acceptable, and we will not tolerate it. And so I definitely stand for that message.
And I recommend, even if you don't think you'll sign it, to reading it.
I agree.
I learn things myself from reading it.
Yeah. Well, we're coming up on the end of our time. Are there any final thoughts that you'd like to share before we end?
I think for VOA employees and people, if you see an Asian American being harassed, the best way to help, I think, as a bystander, is to intervene, but not to engage with the assailant, because that just sort of encourages them, but to actually just check in with your Asian American friend or neighbor, and to just be a good neighbor by identifying with them, engaging them, and then the assailant will see that they're supported, that there are people around them. And so appreciate our allies in different communities of color. And if you're Asian American yourself, I hope you won't feel the fear, stigmatize yourself or internalize this hate, but rather that I think your Asian American heritage and background is actually really a gift that you should embrace. And by working together and by developing a collective voice, I think we could help everybody during this global pandemic.
Wonderful. Thank you, Russell. Great message.
Thanks.
And Rita, would you like to say any final words?
Just that I know that the people of Volunteers of America have good hearts. And so I'm really grateful, Russell, that you were willing to share this with us, because I think it will do a lot of good for us.
Okay, thank you.
Wonderful. Thank you, Russell. It was a pleasure, and I feel honored to have had you on this program, and I look forward to sharing this information with others. Please take care and be well.
Okay, thank you.
You're welcome.